You may sometimes wonder, why is that medication taking so long to come up from pharmacy? What are they doing down there? Let's follow one order on its journey through the pharmacy department and back up to the patient. First of all, your order is not alone. The pharmacy department processes about 1,500 orders each day. Your order's journey starts when it is faxed to the pharmacy. A pharmacy technician or assistant retrieves the order off of the fax machine. Usually there are a stack of orders waiting to be processed. The faxes are prioritized based on where they are sent from. Critical care orders are processed before regular wards. The technician or assistant enters the order into Meditech. The technician checks for allergies, enters doses based on patient weight, and clarifies orders. This often requires a call to the nursing unit. Once the order is entered, it requires verification from a pharmacist. Orders that require a medication being sent to the ward are prioritized to be verified before orders with ward stock medication. A pharmacist must then verify the order. The pharmacist must ensure that the right patient is getting the right medication at the right dose. The pharmacist looks at many different things prior to verifying an order. They check the patient's profile for allergies and renal function. The medication profile is checked to determine if there are any duplicate or interacting medications. Antibiotics are assessed for appropriateness. Many times, when a pharmacist identifies a problem, the prescriber has to be contacted. This takes time, but it ensures that your patient is getting the proper medication. Once the pharmacist verifies the order, labels print out for the medications that need to be sent to the ward. A technician or assistant retrieves the medications from the dispensary shelves and packages the medications. Sometimes medications need to be compounded or prepared in a sterile environment. Once the medication is prepared, another technician or assistant must ensure that it has been prepared correctly. The medications are put into plastic bins with other medications for the ward. The medications in the ward bin are then sent up in a tube or train. The train ride can take a long time. Often there aren't any trains in the pharmacy, so there's a delay in sending the medication to the ward. Finally, the medication arrives on the ward. Once the medication is retrieved from the train, it is given to the person who is responsible to give it to the patient. The patient gets his or her medication. Here's some ways that you can help us streamline the process. Make sure the addressograph is readable. You would be surprised how often this is a problem. Make sure the order is legible prior to faxing. Think about whether the order makes sense to someone who doesn't know the patient. Are the intentions of the order clear? If the patient is ordered a medication that is dosed based on weight, like dalteparin or vancomycin, write the patient's weight on the order. There's a new safe order writing policy. This policy guides prescribers on the clearest way to write orders to avoid confusion. The pharmacy department is here to optimize drug therapy to improve patient outcomes. Thank you for helping us.